We begin tonight with an issue 7 News has been diving into for months: healthcare concerns for our local veterans. A troubling report released today out of the VA Office of Inspector General. In that report, health records of 42 Buffalo VA patients who all had care that was mismanaged. The report outlines how under VA leadership there were multiple care scheduling delays that ultimately resulted in patient harm. The report states that one veteran with cancer spreading in their body waited 9 weeks for radiation. Another with ongoing seizures waited 10 months for just a consultation by a neurosurgeon. And one veteran died while waiting over 2 months to receive radiation therapy. Now, this report grabbing the attention of local elected officials, both calling this report and the complete lack of care unacceptable. Tonight, 2 congressmen voicing their frustration with the leadership involved at the Buffalo VA, and I dig deeper into the recommendations made by the Inspector General on how to improve health care quality. Congressman Nick Langworthy did not hold back on his disappointment in the sequence of events that have been outlined in this 46-page Inspector General report.
There is absolutely no excuse for this level of negligence that led to patients dying and suffering needlessly. If you cannot manage your basic responsibility of ensuring our veterans receive timely care, you have no business overseeing their health.
And Congressman Tim Kennedy put an emphasis on leadership being the root of the cause.
At the end of the day, it comes down to leadership at the top. That's why the leaders were removed, and the obligation that the leaders at the top of the Buffalo VA and every VA hospital across America has is to make sure that the patients that are coming in there for services, our veterans that have donned the military uniform, heroes in America, get the health care that they've earned.
But the ultimate leadership of this hospital must be held accountable. They cannot be reassigned to other roles or venues. They can't be allowed to do this again.
The report states 4 recommendations for the VA Western New York Healthcare System Director that are set to improve care at the Buffalo VA. The first is a review of system leaders' responses towards repeated concerns about delayed community care consults. The second is implement an effective process to ensure consistency with processing consults within Veterans Health Administration and audits for compliance. Third, implement standardized operating procedures for consult management consistent with veterans. And finally, efforts to conduct an institutional disclosure to patient A's family are made, and that the disclosure is documented in the patient's electronic health record. According to the report, patient A is a patient who was not given radiation therapy to treat their cancer pain. The report states that patient's cancer-related pain became excruciating in the last 2 months of the patient's life. I reached out to Democratic New York State Assemblyman for the 142nd District, Patrick Burke, today, who released this statement in part. I am proud of the work my office has done to shine a spotlight on the unacceptable and at times inhumane practices at the Buffalo VA. This report confirms what we long suspected in painful detail. The Buffalo VA has failed in its mission. According to Congressman Kennedy, the Undersecretary of the VA will be here in Buffalo on Monday to address issues, tour the facility, and meet with healthcare practitioners. We're also told to expect hearings in the ongoing investigations into Buffalo's VA leadership in the near future.